Whenever you respond to an emergency, the very first thing you want to do is conduct a visual survey. That simply means checking the scene and make sure the scene is safe. So if you're safe before you enter the emergency scene, look around, make sure the scene is safe. Are you safe? Is the patient safe? Are there other people around, and are they safe? If the scene is safe, upon your initial impression, you should always look for life-threatening bleeding. So when you're looking at the patient, you're trying to size up, trying to determine what is going on, look for life-threatening bleeding. If there's any life-threatening bleeding, use any available resources you have to control that bleeding. Make sure 911 has been called at that point, okay? Now we know when it comes to bleeding, the first point of contact is through direct pressure. All right, so when I apply direct pressure, use any available resources. That means if you have a face towel, if you have a cloth, if you have a t-shirt, whatever it is that you can use to help you to control the bleeding, use it. If you don't have any available resources like that, put you on some gloves, apply direct pressure until the EMS arrives or you are able to control that bleeding. Now, if the flow of blood is continuous and the volume is like equal to a half of a soda pop, can of soda pop, there might be blood that's even squirting from that wound. That's a severe trauma. You need a tourniquet and or hemostatic dressing. Okay, and American Red Cross has come out with a program called FAST, First Aid for Severe Trauma. It is a program that will help you, that'll teach you how to use a tourniquet. And I recommend all my BLS providers as well as my lay responders to take that training, okay? But, yes ma'am.
Do we sign up for that the same way we signed up for the BLS?
Lord.
Oh, sorry. Do we sign up for that the same way we signed up for the BLS?
Yes, you would.
And it's FAST?
It's called FAST, First Aid for Severe Trauma, okay? And so you would need a tourniquet, okay? So use a tourniquet, use hemostatic dressing to control that bleeding. Those are other available resources. Now, after you've, let's say there's no bleeding, okay? You check the scene, you quickly scan the body, there's no bleeding. The next thing you want to do is you want to check for responsiveness. So you will shout the person's name. Well, let me step back. Let me go ahead and give you the scenario. So here's the first scenario. Let's say, I'm going to put all of you in a hospital setting, okay? You're all in a hospital setting. You are walking past one of your patient's rooms, okay? As you would just walk past his room, you heard a noise, a clatter, like something has fallen over. You back up. You check the scene. You conduct your visual survey before you walk in this room, okay? You realize that the scene is safe. And as you're approaching the person, you notice, you quickly scan the body. There's no life-threatening bleeding, but the patient is sitting on the floor. He's holding his arm. He's crying, and he's asking you to help. What condition is that person in? Take a look at your condition cards and tell me what condition is that person in. Okay? All right. Okay. All right. What condition is that person in? The person is responsive. Okay? And how do you give care to a person who is responsive? Show me your cards. Okay? How do you give care? Look at your care cards. Okay? All right. How do you give care? Okay? Very good. Yeah, you obtain consent. You let the person know who you are. Okay, if this is not your patient, but you know he's on the floor, you go in, you let the person know who you are, what level of training you have. I'm a registered nurse, you know, and I'm here to help you. And then you obtain consent. Can I help you? The person says yes. You give care based on whatever condition that he's in. Okay. Here's the second scenario. You're coming to check on one of your patients. You walk into his room for the morning. Okay, and as you approach his bed, you notice he doesn't appear to be moving. You quickly scan his body, you realize there's no bleeding, okay? You have to check for responsiveness. His skin is cyanotic, so you're gonna check for responsiveness. The way you check for responsiveness is to shout the person's name if you know it, to see if he's gonna respond to your voice. You're gonna tap the person's shoulders to see if he's gonna respond to that stimuli, and then you're gonna shout the person's name again like this. Sir, are you okay? Are you okay? Now, if this person doesn't respond at this point, we need to call 911, have someone activate the EMS and bring us an AED. So if I say to you, call 911 and bring me an AED, this person is not responding, your response would be? I'll call 911 and get the AED. Now, the next step is to conduct the ABCs. Now, if you took BLS before, you might have remembered the acronym CAB, right? circulation, airway, breathing. Well, now the update for 2020 and 2021 is the mnemonic ABC. So we start with opening up the airway. So A stands for airway. You open up the airway by doing a head tilt chin lift technique. Place one hand on the person's forehead, two fingers on the bony part of the chin, and tilt the head back. Now for the adult, the head should be in a past neutral position. For a child, a slightly past neutral position. And for an infant, a neutral position. You don't want to tilt the head back too far because you're going to cut off the airway. Okay, so slightly past neutral position. That's A for the airway. B stands for breathing. So you're going to check his breathing by placing your ear up to his nose and mouth to see if you can feel or hear air escaping from the nose and mouth. You're going to take your eyes, focus it on the person's chest. Okay, you're going to check no more than 10 seconds. Now, the previous training was 5 to 10 seconds. Now, they just want you to check all the way up to 10 seconds. And while you're focusing on that chest, you're going to be looking around with your eyes again just to see if there's any life-threatening bleeding in case you missed it in the first time. Simultaneously, you're going to be checking for a pulse. Now, show me where would you check the pulse. And this is called the carotid pulse, okay? So you're going to open the airway, fingers on the carotid pulse, ear to the nose and mouth, and you're going to count no more than 10 seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10. Now, let's say that after you check for 10 seconds, although he's not responding to your voice and he's not responding to your touch, when you checked his breathing, he was clearly breathing. Chest was clearly rising and falling. And he had a pulse. Not responding to your touch, not responding to your sound, but having a pulse and breathing. What condition is that person in? Show me. What condition? Okay. All right. Okay. And how do we respond to a person who is unresponsive? How do you respond? How do you care for a person who is unresponsive? Okay. All right. Okay. All right. How do you care for a person who is unresponsive? Okay, yeah, you roll that person into the recovery position. Does anybody know what the purpose of the recovery position is for? What's the purpose of the recovery position? Come on, nurses. The purpose of the recovery position is to protect the person's airway. Does everybody know what the recovery position looks like? Does everybody know what the recovery position looks like? Okay, everybody know. Okay, so you're going to roll that person into the recovery position, and you're going to continue to monitor that person's breathing. Now, we've already called 911. We've activated 911. We're waiting on someone to bring the AED. This person is unresponsive. We're rolling him over. We're going to continue to monitor his breathing. Now, the rule of thumb is you should always check your patient every 2 minutes. This is when the rapid response come in. So the rule of thumb is 2 minutes, 2 minutes, 2 minutes. You should always reassess your patient every 2 minutes. So let's say that you've been monitoring this person's breathing. Okay, 2 minutes is almost up. EMS is not here. AED has not arrived. But then you hear some noise coming from this person, like he might be trying to breathe or something. You go, oh my goodness, he's trying to breathe. So you roll him back over in a supine position. You conduct your ABCs. You roll him over, you continue, you do your ABCs. You open the airway, check for breathing while simultaneously checking for circulation, okay? Now this time you found that the breathing that he had, well, it's not as strong as it was the first time, okay? Or maybe he doesn't have any breathing. And that noise that you heard, that's agonal breathing, that's not real breathing. But when you checked his pulse, he clearly had a pulse. Agonal breathing, shallow breathing, no breathing, plus a pulse. What condition is that person in? Agonal breathing, shallow breathing, plus a pulse, or no breathing plus a pulse, okay? He is in respiratory arrest, yes. And how do we give care to a person in respiratory arrest? How do you give care? Okay, yes. You begin delivering one ventilation every 6 seconds. Now, your previous training was to deliver one ventilation every 6 to 8 seconds. Well, scratch the 8 seconds. They just want you to give one ventilation every 6 seconds. Now, let's assume you are giving one ventilation every 6 seconds, and the rule of thumb is to reassess every 2 minutes 2 minutes is up. You've been delivering ventilations for 6 seconds, every 6 seconds. How many ventilations would you have delivered in a 2-minute cycle? Anybody? 20, okay? Because it's 60 seconds in a minute. You got 2 minutes, 120, you got 6 seconds. Divide that by that 120, you got 20 ventilations, okay? So let's say you've been, 2 minutes is up. You conduct your ABCs again, right? EMS has not arrived, AED has not arrived. You've been conducting your 2 minutes. 2 minutes is up. You do your ABCs again. You open his airway, you check breathing while simultaneously checking for circulation. This time you found that not only does he have any breathing, but the pulse you felt 2 minutes ago is no longer there. No breathing, no pulse. What condition is that person in? Cardiac arrest. And how do we give care to a person in cardiac arrest? Yes, you start CPR. You begin CPR starting with chest compressions, okay? Now, a CPR cycle is 30 chest compressions and 2 rescue breaths. Chest compressions should be done at a rate of 100 to 120 chest compressions per minute, okay? And that's true for the adult, it's true for the child, and it's true for the infant. Okay, I'm going to say it again. How fast you should be going when you're doing your chest compressions, the rate is 100 to 120. And that rate does not change. It's true for the adult, you do that for the child, you do that for the infant. When it comes to depthness, for the adult, you have to be at least 2 inches deep, not more than 2.4 inches deep. For a child, you should be about 2 inches deep. And for an infant, 1.5 inches deep, okay? All right, so let's say you've been doing your CPR, the 30 chest compressions and 2 rescue breaths, and the AED has arrived, okay? Go ahead and pick up your AED machine. We're gonna talk about the AED machine in just a moment. Thank you, ladies, for participating in that activity. So what I've just demonstrated, ladies, is what the rapid assessment looks like. So let's just kind of recap. The person that you heard, clatter in his room, you went to check on him, okay? You checked the scene, you scanned the body, you found that the person was responsive. Anytime a person is crying, showing pain, able to communicate with you, that person is responsive. And you gave care based on whatever condition that was, okay? The other patient that you walk into his room, okay, you notice he wasn't moving, okay? And his skin was cyanotic. You conducted your shout, tap, shout sequence, and he was not responding to that. You did your ABCs. You found that he's not responding to your touch, he's not responding to your sound, but he does have breathing and he does have a pulse. We know that the problem in this case is what? He's unresponsive. So we gave care based on that condition. We wrote him over in a recovery position. We continued to monitor for breathing until EMS arrives, okay? We conducted another reassessment. 2 minutes later, we did another reassessment. We found at this time that he has shallow breathing, agonal breathing, or no breathing, but he still has a pulse. The problem here is that he's in respiratory arrest. So we began giving care based on that condition. We gave 1 ventilation every 6 seconds. Okay, we did that for 2 minutes. EMS still have not arrived. We conduct another rapid assessment. We do our ABCs. We found that this time, not only does he have any breathing, he no longer has a pulse. The problem is he's in cardiac arrest. We give care based on that condition. We began doing CPR starting with chest compressions. And we'll reassess him every 2 minutes until you're done with that patient. That's what the rapid assessment looked like. So it's a possibility that he's in cardiac arrest and 2 minutes later, he could be back in respiratory arrest. Then you go back and you begin giving that 1 ventilation every 6 seconds, and then you reassess until you're done with the patient. Any questions on that? All right, very good.